Hello everyone, this is George Delclos, and before we get into the second theme of this workshop, I wanted to present a brief summary of our discussion from the initial part of this workshop, which was held earlier this month. You will recall that both sessions of the workshops are being driven by a conceptual model of the horizontal and vertical expansion for occupational safety and health. The workshop first part that was held in early June centered on the horizontal expansion, that is the integration of traditional occupational safety and health research with non-work based factors such as personal risk factors, social and economic risk factors at many levels. On June 4th, we all met as a group and discussed three questions that had been voted on in terms of being identified as having top priority. And then we addressed specific aspects within these three questions. The three questions that the group discussed in separate breakout groups, and then we came back together, were number one, how do we build the evidence base for the interrelationships between work and other life domains to support the expansion of occupational safety and health paradigms? Second, given the changing paradigms anticipated in the future of work, what new methods will be needed to fully explore research questions? And third, what new approaches are needed to apply research findings in the future of work? These three questions also aligned with the objectives of our workshop, which were the overall goal of our workshop, which was to address research needs, methods, and translation in the face of this expanded paradigm. Within each of the three questions, we asked about some specific aspects. First of all, what were the stakeholder groups that would have would be needed to address each of these issues? And just a very brief summary. In general, there were a lot of commonalities across the three questions with respect to identifying what turned out to be a very long list of stakeholders that we really don't have time to spell out here, but that essentially represented the groups that you would expect beyond occupational safety and health professionals. That is, stakeholders from the community, from government, from professions, the technology sector, workers, and employers. And for the translation question, in addition to identifying these stakeholders, the group also underscored the importance of who and how we communicate research results to, with a particular emphasis on improving our ways of communicating results to workers. Within the three questions, we also addressed what resources or information would be needed. And so even though the list of suggestions is much more extensive, the main findings were, or the main recommendations were, that we needed a mutual understanding of the connections between non-occupational safety and health stakeholders and traditional OSH researchers, so that together we can better identify pathways by which we can combine research methods both within occupational safety and health and research methods that are brought in by other stakeholder groups, emphasizing that this approach needed to be interprofessional and transdisciplinary. We thought it was important to incorporate behavioral methods and behavioral change, employment variables, policy analysis, impact at multiple levels, from the very beginning. In other words, engaging stakeholders at the study design stage or sooner, and incorporating different variables that come from these stakeholder groups together with traditional OSH measures. And very importantly, to clearly define the population we wish to impact. It was important that we also study workers not just in the workplace as we typically do in occupational safety and research, but also their lives outside of the workplace. This is with an eye towards better integrating work and non-work related factors, and a better integration of environmental variables into OSH research, given the importance of climate change in affecting the future of work. In terms of new data sources, it was recognized that, for example, big data may play a role, but that we shouldn't also ignore traditional occupational safety and health surveillance systems and data sources, but the emphasis needed to be on improving them, making sure they are of high quality, accurate, and meaningful. A third aspect we addressed within each of the three questions were the outcomes that we desire. And among the most often mentioned were that we should be conducting research today that will still be relevant several years down the line. We need to be better able to define how our research contributes to policy changes, behavior changes, and the implementation of new workplace policies and procedures and interventions. Improving existing occupational safety and health systems by modifying variables to reflect current societal perspectives. So for example, as a societal perspective on sex or gender changes from simply a binary variable to multiple options, we too should adapt our existing occupational safety and health systems to reflect these changes in society. And the same goes for race and ethnicity concepts. We need to design studies to better follow workers across jobs and over their life course, which is something we will be dealing with in this second part of the workshop in the upcoming days. We should incorporate more non-occupational safety and health concepts into occupational safety and health research, such as the role of power dynamics or equity and justice in shaping change, or how to use negotiation as a way of securing interventions. And finally, we need to balance worker well-being, which is one of the ultimate objectives of both the NIOSH Total Worker Health initiative, as well as one of the desired outcomes of the expanded focus for occupational safety and health, but need to balance that with recognition of employer needs so that the two are in balance and compatible. And finally, we addressed remaining gaps in each of these three questions. And so we identify that we need data that seamlessly can connect work and other life domains. We need to incorporate variables from other professions, such as economics or labor indicators like wages, productivity measures, the impact of medical leave policies, and non-standard work arrangements as just a sampling of some of those variables that traditionally we have not been considering as much in occupational safety and health research. Definitely we need to incorporate smaller employers and stakeholder groups into our research instead of just basing a lot of the research on larger corporations. In methods, we advocated a greater use of a full cycle approach to research, which means a greater emphasis on mixed methods, especially greater use of participatory and qualitative methods, as well as impact evaluation. Very importantly, we need to shorten the lag time between when a study is designed and conducted and when it is ultimately implemented. And finally, studies must become more generalizable, adaptable, and sustainable, even in the face of uncertainty that the various future work scenarios present. So that was just a brief synthesis of our discussion, sort of as a starting point as we consider going into the second part of this workshop. Thank you very much.